doctors at the oncology department of the Komfo Teaching Hospital are intensifying their protest over a broken down linear accelerator system used for radiotherapy services at the facility. The health workers on Monday abandoned the consultation rooms over what they say is delay in the repair of the machine, which they claimed is affecting healthcare delivery. ChannelOne News' Ashanti Regional Correspondent Hafiz Tijani report.
The linear accelerator used for radiotherapy services at the hospital broke down in October 2023. Although it has been repaired, management explains it is awaiting the arrival of a water phantom which will be used to calibrate the equipment to make it functional. The delays in making the equipment functional, which is used for the treatment of various cancers, have angered doctors at the oncology department who, on several occasions, have threatened to lay down their tools. The doctors on Monday abandoned duty over the malfunctioning equipment, and patients who came from outside the Ashanti region to access services were left without care. Management says that prior to placing an order for a new phantom, efforts to get a water phantom as an interim solution proved futile. Although management says it has engaged with the doctors on efforts to get the water phantom to Ghana from the USA, the doctors insist the malfunctioning equipment is crippling healthcare at the department. Deputy Medical Director at the Komfo Teaching Hospital, Dr. Opari Labi, has been speaking about the developments.
That shows you how delicate it is. So it is unfortunate that our colleagues, a section of our colleagues in oncology, have taken this action because we have shown them a lot of good faith. We have communicated with them. We've gone to them several times. We've had interactions at several levels. And if you look at this hospital and the various, I'll say, challenges that we've had, because the equipment and the structure are under a lot of pressure because of the numbers of patients that we handle. There have been so many other directorates who are waiting, or in the recent past, have been expecting equipment. Some have received the equipment, others are still waiting. And they've been patient. If everyone who was waiting for some equipment or some logistics decided to go on strike, then the hospital would just grind to a halt.
He also spoke about the impact the strike by the workers at the oncology department will have on healthcare delivery.
If even a section of the doctors decided that they would stay, as we heard, that their head of department and I think a few others decided to stay and work whilst a section decided to go on strike, you can imagine that they are going to be under a lot of pressure, because that means the doctor to patient ratio is going to get worse, right? So it means that patients are going to spend a longer time waiting to be seen, and then the doctors are also going to spend longer hours at work, which also has its psychological and physical effects, not only on the doctors, but the nurses. All the staff who are working there will have to put in extra to see the patients. So the strike has an impact on us. In fact, when the strike hadn't even started, the news of the strike alone made us very anxious.
ChannelOne news sources indicate the doctors will not budge, even with the intervention of the Ghana Medical Association and the leadership of the Komfo Doctors Association.
This water phantom here currently is not working, and management is awaiting the delivery of a new water phantom to enable them calibrate this LINAC to make it functional. Management is thus appealing to health workers at the oncology department to be patient as they take steps to address the problems here. Hafiz Tijani, ChannelOne Newsroom, Komfo Teaching Hospital, Ashanti region.